Discounts on all your favorite items. Come into White's Choice and catch unmatched discounts while shopping. Find your discount on the bell attached to the products of the day. It's that easy to save big and be merry at White's Choice. Promotion runs throughout December. Visit us at the Lafayette Plaza for all your automotive and car care supplies. Call us today at 459-3969 or WhatsApp 728-4333. White's Choice. Committed to quality.
It's the most wonderful time of the year, and you can find the season's best at Courts. Save up to 50% store-wide, plus get free gifts with select purchases. Get the best brands, best prices, and more. Shop today with no cash and have 90 days to make your first payment and choose your payment term from 3 to 48 months. The season's best is at Courts, bringing value home. Special conditions apply. Offer ends December 31st, 2022.
Casualty 911, 10 a.m. to 11 a.m. with the consultant. Health is not merely the absence of diseases. It is your social, economic, physical, spiritual, and mental well-being. Just imagine you on 88.5 Super FM, talking, questioning, sharing your experience, information, education, entertainment, news, instructions, advice on diabetes, high blood pressure, strokes, menopause, AIDS, pregnancy, sex.
Sex? Did you say sex?
As prescribed, take your medication, exercise, and diet. On 88.5 Super FM, tell a friend, call your neighbor. Casualty 911 is on.
And of course, good morning. It's now 6 minutes after 10 a.m. in Solution, the rest of the Eastern Caribbean, the 5th day of December 2022. And it's 10 a.m. on a Monday, so it's time for Casualty 911. I have my wonderful guests here with me. Well, the hosts, they're the hosts. I'm here with me. I got Fawn and Miss Wilson, Miss Louisa Wilson. Is here this morning. Good morning, Miss Wilson. Good morning, Fawn. How you doing?
Good morning, Romanus.
Good morning, Romanus.
And good morning to our listeners. Always a pleasure to be here. To our regular listeners, welcome, welcome, welcome. And to our new listeners, open your ears and listen up. We have an interesting topic today. Maybe not something that you really want to talk about before Christmas, but it's a very good time to talk about it because things happen during the season.
Okay. now I'm anxious to know what this is. I'm excited.
But before we get into our topic this morning, there is an urgent request for blood from the blood bank. A press release came out yesterday, so I'm just going to read it out so that our listeners can be aware and so that you could make the decision to donate blood. You never know who will benefit from it. You know, a lot of people like to say, I'll only donate if it's my family. But most times, the blood that you donate does not go directly to your family member.
I think most people misunderstand that.
Yes, they misunderstand that. So in as much as you may have a family member in the hospital and they need some blood, they'll tell you to donate, but you will just be replacing what will be used because the blood has to go through a process before it can be used with any patient.
Okay, so whatever you donate whilst your family member is there, it's just used to replenish the bank.
Exactly.
Yeah. And sometimes you don't have the same blood type, so
exactly, so they cannot receive it anyway.
Yes.
The press release from the Ministry of Health, Wellness and Elderly Affairs dated December 4th, 2022. Blood bank in need of blood. The Owen King European Hospital is extending an urgent call to the public to donate blood. In recent, the need for blood has increased due to a rise in road accidents and physical assaults, therefore placing a great burden on the St. Lucia Blood Bank services. As a result, a schedule has been created for persons seeking to donate to the blood bank through its mobile services. On Mondays, Wednesdays, and Fridays, the blood bank will be available at the William Peter Boulevard, Castries. On Tuesdays and Thursdays, the mobile service will be available at the OKEUH. Donating blood at this time is critical as no one knows whose life may be saved tomorrow. So as you may have noted, it talks about blood donation in Castries. We in the South, most people would not go to Castries to donate blood. If you happen to be in Castries, then you know that you can donate at the William Peter Boulevard. In the South, St. Jude Hospital lab, you can donate there. You can walk in, just go to the lab to donate blood. They used to have a service on Fridays. I'm not sure if it's up and running. I can verify and send the information along. But the lab is open. You can go to the St. Jude Hospital lab to make donations, blood donations. I used to be a donor myself. I have not donated in a little while. So that is something I will consider.
look at Louisa's face. Louisa,
that is something I will consider.
How often do you donate?
I'm kind of afraid of the needle.
Okay, so you have, there's a name for that.
Needle phobia?
No, there's another name.
What's it?
I cannot remember the
sure.
scientific name.
But there's another name.
But I would say to those of you who may have a bit of a fear, you always need to remember the objective. Why are you doing it? And then the other thing is you can mention it to whoever is going to be dealing with you so that, you know, they can speak to you, help to calm you down if you need a little music. The process is not very difficult a process, you know. It's just that the needle looks quite big, but you don't have to look at them putting it into your arm. You don't have to look and say, oh my goodness, they're taking so much blood.
Yeah, that's what scares me.
You
When I
know?
look on the side, see so much blood in that. Yeah.
But listen,
Okay.
you know, sometimes you go and donate blood and you might be the one needing your own blood, you know. That
that's
can work,
true.
you know. So
That
that can save your life, you know. Probably
Oh,
just a way of storing it.
I remember one time I donated at the blood bank in Vieux-Fort. They were out, the bus was out. And the very weekend, my father went to hospital, and by the next week, we were out asking people to donate blood. So you just never know when these things, when it can hit home. And it's not, I can tell you from personal experience, it is not a good feeling when you're already so stressed with everything going on to be going around begging people please to donate blood for this person and that sort of thing. It would be wonderful if people could just go into hospital and there's enough blood, because people know that it's a need, and we just continue to donate and replenish the stocks all the time.
And if you're afraid, the body, you know, replenishes.
The body
itself,
replenishes itself. So within 4 months, you can donate again.
so
That's to
Louisa, don't
show
be
you
afraid,
how
yes.
quickly the body replenishes the blood. You just need to make sure that you have had a meal and you drink a lot of water and that sort of thing.
And they'll give you a malt, a free
Yes,
malt.
they give you a free malt.
Well, all well and good, but I mean,
Thank you for donating.
I'll have to develop the courage, and I think some of us do need to develop the courage to take that step for the new year. Hopefully, I will have enough courage for the new year, and then, you know, go and donate the blood.
So, Fawn, how often do you think somebody needs to go and donate? Like every
Well,
6
every
months?
4 months, you can donate. For men, I believe it's every 3 months. Women, you know, you need a little longer. So about every 4 months.
Okay. And I heard short people cannot donate. Is that
Short people cannot donate. But this short lady does it.
I've heard that, but anyways,
You see how the myths come out?
it's probably a beef. No,
Busted.
I have a family member of mine that is short, and then she went to donate, and they could not take from her because they're saying that she has just enough for herself.
Okay, well, what happens is that they test you before to
Yeah.
check whether you have enough, whether your pressure is okay. Because one time I went to donate and my pressure was so low, they asked me to leave the place. Because, you know? So they do check you before
taking to make sure before they take all you have.
Exactly, they do.
Yes.
That is true, because this year we had Karen Louis from
the blood bank in Castries.
The blood bank in Castries. We had a program this year on that, and she really spoke about it, and then she did encourage persons to come out to donate blood. And one of the things I would like to say, as Fawn said, I mean, sometimes when it hits home, you really see the need for it. And don't forget, persons, I mean, if you have, I mean, just take some time. Just like you take some time to go to Viewfort, go somewhere, shop, just take some time and go to St. Jude's from the south and donate blood. I mean, it goes a long way.
And the season is usually a busy time where we also have a lot of need for blood, because there are so many road accidents, there are assaults, and these days, oh my goodness, I don't even want to talk about
it's crazy.
The level of gun violence, and at that point people lose a lot of blood. So when you have to do surgeries and so on those people, you require a lot of blood. But the season in itself is usually a busy time where there's a high need for blood, usually because of road accidents. But anyway, I think we have spoken enough about the blood donations. It's important.
Very important.
However, we also have to move on to our topic for the day, and I will let Louisa introduce the topic because it's her baby.
Well, it's not my Let me say good morning to all our listeners. It's a pleasure having Fawn here with me once again, because it's a while we haven't been on together. Always team up on the program. So it's nice to have you with me today, Fawn. Let me just say that this month, I mean, that's why I'm in my red, not because it's Christmas season, but we celebrated World AIDS Day, and December 1st was the day.
Oh.
And, a lot of people are wondering, we still have AIDS? We still have HIV? They're wondering if it is still there. Yes, it is still there. And we still have to be cautious. We still have to take precautionary measures. I know a lot of us like to, under the influence of alcohol and other stuff, like to take chances, but it's not always wise. And we must take responsibility. And that's what we want persons to do. So December 1st was World AIDS Day, and the theme for this year is Equalize, and US AIDS is urging us to address inequalities which are holding back the progress of ending AIDS. They want to completely, nobody should have HIV/AIDS in the world. They just want to stop it completely, and that is what the aim is. I don't know how feasible it is.
Yeah, how do they propose
but,
making this possible?
With time and progress, it happens. Other things have been eradicated and so on, other diseases. But with AIDS, they're hoping that it can be, at the end of the day, no one should have HIV and AIDS.
Well, I can say AIDS being eradicated, but HIV is another topic. But AIDS, it can happen. Somebody gets HIV before they get AIDS. So
exactly.
If they get the proper treatment, then there's no reason why they should get to the point of AIDS.
And with HIV we also need to think about high risk behaviors. Louisa mentioned the alcohol. So there's alcohol, there's having multiple partners, there's having not using any protection, and all of those. So all of those things contribute. Mm-hmm. And if we can reduce on those high risk behaviors, we can reduce the number of people being infected with HIV and whether or not it progresses to AIDS. Also behavior, because then you need to seek treatment.
Yes.
Okay?
So that is where the education comes in with.
Exactly.
And you need to go and get tested too. A lot of
Yes.
persons are afraid of getting tested. And that's one of the issues. I remember I, for one, at a health fair, going out there and I have to go and get tested. So I'm speaking to nurse and I'm saying, nurse, you know, I did quite a bit of madness in my time. You know, I'm saying, nurse, be careful, you know. So here am I going to get, it was a rapid HIV and with the syphilis, and I'm saying, nurse, be careful when you prick me. I am, you know, and I'm going out there and I'm really, really scared. And I'm saying, oh my God, that's when you really think of all the behaviors for all what you did. At the time, it's fun, it's exciting, but when it boils down to going and get tested, boy, let me tell you.
It's nerve-wracking. I've done it before. And
Yeah.
then you see that point where they take your blood and then you have to wait for the result.
15 minutes.
That is a long 15 minutes.
Let me tell you, every minute I had to watch nurse and say, my time up already. My time up.
And I think they made me wait because I don't know what was going on. So,
Maybe they had several people.
Yeah, there was a busy
Yeah.
day, so I waited a long
Yeah.
time.
Boy, all of that, if you're very much,
You better figure.
So the rapid test, you should get your results within 15 minutes. But sometimes if you go to test and there are several people, they might test 5 people, and then after the last person, then they start reading out, calling people back in for their results.
Oh yeah, that was my thing. I did not do a rapid test. I went to.
Oh, you went to.
Oh.
Yeah, so it
Okay.
was. They used the machine and all that. Yeah, I thought. Anyways.
Well, boy.
So the rapid test could probably help with that.
That's true.
Yes.
Yeah.
I just thought the rapid test. I don't know. I just didn't.
You did not have confidence in it.
Yeah.
Okay, well, the rapid test is, it's a good test. There are steps to it. So, for example, if you do a rapid and they get, they don't say positive, you know. They will not tell you that you're positive for HIV based on the rapid test. They would tell you, I forget. It's reactive. So it's reactive. So then they would follow it up with another test. And if that one is also reactive, then you progress to the third.
Oh.
But if you get non-reactive on the rapid, then you're pretty much safe.
Yeah. But I think
But it also depends on the window period. So all of that would be discussed with the nurse. Or whoever is doing the testing for you. There's a window period. So if you did something last night and you figure this morning you wake up and you say, Monsieur, that's so. I feel maybe that person had something. Let me go and test. No.
You have to wait.
You have to wait. You have to wait at least, I think it's about 18 days, at least 18 days with the rapid HIV test. So there's a window period. You can say 3 weeks, say about 3 weeks.
Because I went to St. Jude. I didn't know about rapid testing. I just went to get a test, and that was the only thing that was offered to me. There was no option to say, all right, do you want a rapid test or do you want this? It was just a test they did.
Okay.
Then when I went to do my, I do my annual checkup something, then my private doctor just did a rapid, and I'm asking him, is that effective? Why did I have to go through that long process at the hospital, and he's using just a little strip of
because
paper.
you went to the lab, so they would probably just
which is the safest thing, the level of accuracy is even higher.
It's higher.
Yeah.
Okay.
So have no fear, you did the right thing.
Yes.
Yeah. And we encourage others to do the right thing. And having said about the rapid test, let me just say that the rapid tests are available at our sexual and reproductive health clinics. We have Nurse Charles, who is trained to do it at the Delsa and Magouge Wellness Center. We have Nurse Samantha, who is at the Etangs Wellness Center, and Nurse Gaston at Fongejac Wellness Center. Also, Nurse Lamontagne offers the service at the Soufrière Hospital every first Thursday of the month.
It's also available in Vieux-Fort at the Vieux-Fort Health Center on Tuesdays during the Sexual and Reproductive Health Clinic. So on every Tuesday, you can go to Vieux-Fort Wellness Center. Nurse Joseph is there. Unfortunately, our other nurse is deceased. I'm not sure who her assistant is these days. And yeah, so on Tuesdays.
What's Nurse Joseph's first name?
Junette.
Oh, Junette.
Nurse
She
Junette
was the one who did the
Joseph.
rapid test for me. She's good. She's good.
Okay.
Yeah.
Nurse Junette Joseph.
Yeah, I'm glad. I'm glad. So these are the services that are available for the other wellness centers. For Magouche Del, say you can always call the center and speak to nurse before you come in, and so on, and then she can guide you accordingly what day is best to come in, and then normally they do a short counseling before the
Yes,
test is
the
done.
testing is done with counseling.
Okay. So, we have not even started with, the topic at hand. And HIV, we know, is a sexually transmitted infection. And that is why we keep on speaking about that. And there are many ways you can actually, get HIV. But before we get into that, we just want to tell people that there is no cure. So that's one of the reasons why you have to take extra precautionary measures, because there is no cure. Although persons can live for many years, as long as they take the treatment early enough and based on
consistently.
compliance and adherence is something that can be very, very difficult for people, especially when taking medication.
But it's very important in terms of managing the condition.
That's true, Fawn. And just to give a quick, recap of what our senior medical officer said of AIDS, from January to December, we've had 8 deaths island-wide, and 917 persons have been diagnosed with HIV, and currently 289 persons are taking the medication. So just to let people know that if you have been diagnosed with HIV, like Fawn said, it is very important that you take the medication. And based on the minister's address for World AIDS Day, they're saying that the medication is free at all our pharmacies in our wellness centers, so persons should take advantage of getting the medication because it's free of charge. You have nothing to pay. So take some time and, go out there, speak to your doctor, and let them prescribe the medication as long as you've been diagnosed with HIV. Go and get the medication at least because it's free of charge. So we're hoping that a lot of persons who have been diagnosed can hear us and, but Fawn, having said that, why would somebody not take the medication if it's free? Because, the medication is free. If you've been diagnosed, just come and get the medication.
Well, there's stigma attached to HIV and AIDS. So if you have been diagnosed with HIV, some people feel they may not feel any confidence with the people that they have to approach to get the medication. They may feel that somebody will see them and hear them and it will get out that they have HIV. And there's this stigma attached. Nobody wants to be an outcast. However, it's in your best interest to take the medication so that you can live a healthier life. You can try to reduce the viral load that would help to keep your immune system in a better condition so that you don't progress as quickly or as easily along the stages of illness as it relates to HIV.
But does this press release say that 900 people are living with
HIV? 917 persons.
and only 289
89 persons are currently taking the medication.
what
That's
hap-
what statistics is saying right
Wow,
now.
that's a big difference.
That's a big difference.
Yes.
And that
So
is why
it means that there are a lot of people out there probably engaging in sexual activity,
risky behavior.
risky behavior in itself,
Which is a
because
crime- which
it
is
is
a
highly unlikely. It is highly unlikely that they would
Abstain.
confide in their partner that they have some. I think it's just very highly unlikely. Some people may, but I think it's highly unlikely.
Isn't it a crime if you know for sure that you have AIDS or HIV that you're supposed to?
I am not sure how we stand in St. Lucia as it relates to that actually being on the law books. We would have to verify. Maybe in some of the more metropolitan countries, yes.
Yeah, it's supposed
but
to be.
yes, when we think about it, we
You
get
you voluntarily put in somebody else's
at
life
risk.
at risk.
I must admit, reading about HIV and AIDS, it was quite scary because, I mean, when you hear somebody have HIV and AIDS and then they have one partner and they didn't inform their partner, I mean, that kind of system right here and there, it's like so many persons getting infected and you don't know. Because if we really look at the symptoms of primary infection when it comes to acute HIV is fever, headache, muscle aches and pain, and joint pain and rash.
basically flu-like symptoms in the first stage.
In the first stage, and that can mean so many things.
Exactly.
And then you saying, "Oh boy, this day I wake up and my body hurting me, and this and that and that," and my goodness,
Sometimes
think of what you could have gotten, and sometimes all of us in the name of love, we're there like I mean, you never think of something like that could have happened to you, and that is why it is so important that you at least come and do the rapid test and find out what is happening. And in the initial stage, what we're saying that even if you have basically the flu-like symptoms, the sore throat, the diarrhea, the weight loss, and all of this, your viral load is still very high. So transmission, you can spread it very, very easily. And that's within the 2 to 4 weeks period after the person has gotten infected. So, I mean, you sleep with one person or you share a needle with another person, especially drug addicts and so on, and these things can happen to you so easily. So persons have to be mindful of all these things. And I just want to say that, from the early onset, that is why we're asking persons, come in if you have been involved in risky behaviors as it relates to sexual encounters, having many partners, and always come in and do your little rapid test at least, every 3 months. Come in to do the little check because you know what it is and so on. So therefore, we have the chronic HIV, and at that stage, there is still white blood cells in your body, and many people do not have any symptoms of infection during that time. But if you're taking the medication, that means you can be at that stage for many, many years and don't develop the severe form of the disease. And the severe form of HIV, it's going up to AIDS. And some people, if you don't take the medication, based on the research I was reading, you can have HIV for between 8 to 10 years and don't develop AIDS as yet.
Wow.
And that is one of the things we have to be mindful of. So all the time you're living with HIV, you're not taking the medication, your viral load is high, and so on, you're able to spread it. And you can live 8 to 10 years looking well, fine, good looking,
And then
especially
no-
for the
yeah.
ladies. I mean, well slim and trim.
And you never know.
And you never know. So, like they said, the antiviral medication is available. So if you're not taking it, that's when you start getting the severe form of the disease after the 8 to 10 years. So after the 8 to 10 years, without the antiviral medication, you develop AIDS.
Which is, there's no cure.
Well, there's still no cure.
Yeah.
But with HIV, at least, there is some form of control because you're taking the drugs. To me, I never read about, come to think of it, I never read about the side effects of the drug.
Well,
But it's
There
better.
are side effects. Some people do have side effects. They could have dizziness, diarrhea, feeling unwell, and all of that. So that may be one of the reasons that some people who may have started might stop. However, it is always good to have open and clear communication with your health provider. So if you are on the medication and having those side effects, have a conversation with your health provider so they can help you to find ways to manage the side effects of the drugs instead of just doing away with them completely, because the objective of taking those drugs is to help you to lower the viral load. And if you can lower the viral load to a level that is low enough, you're less likely to transmit to another person. And it would help to keep your immune system working at a higher level. Because once you have progressed and you get to AIDS, the stage of AIDS, your viral load is high. So they usually say AIDS doesn't kill you. It's something else that will kill you.
I think
Opportunistic infections, it's called. So your immune system is so battered, it's in such a poor state that you get an infection and your body just cannot cope.
Cannot fight it.
It cannot cope.
That is so true, Fawn.
Well, that is what AIDS is. The name, because it's an acronym, right? AIDS is an acronym.
Yes.
It
Yes.
means, what does it mean?
Autoimmune deficiency syndrome.
Yeah, so that's, it prevents your
Acquired
immune
autoimmune.
system.
Acquired
Yeah, so it prevents your
immunodeficiency
immune
syndrome.
system from working properly. So, you can get something simple as, the common cold, and that can kill you. Like, it's simple
It's
things.
usually some some other
tuberculosis.
infections.
Yeah,
yes.
things very-
Some other
Tuberculosis
infections.
and
'cause your body
other
cannot fight,
STIs
Yes.
and cancers.
And cancers.
Your
These
body
are the
cannot
things-
fight anything at that point.
Yes, so these are the things that it really doesn't protect your body against. And that is one of the things that we really want persons to,
And
think
I'm
of
so
doing.
happy that Romanus, from the very beginning, he said, well, there's HIV and there's AIDS, because some people still have the notion that HIV and AIDS are the same thing. Whereas AIDS is like the last stage. It's the end stage
the
of
end.
HIV.
And one of the things we have to make mention is that you cannot get HIV or AIDS by hugging, kissing, shaking hands with somebody that is infected, because a lot of persons want you.
Yeah, that's part of the stigma. So the person has HIV, and there you go. You say, me, mable moun sa touche moi yo, ini AIDS. No, the person has HIV and cannot transmit it to you by talking to you, or even a closed mouth kiss. Some people might not even want to do that, but because HIV is really transmitted through the exchange of blood and body fluids. Now, you need to exchange so much saliva in order for it to happen. It can happen. It can happen, but usually if it does happen, it's because the person has other issues with the mouth. So you have gum disease, bleeding gums, you have ulcers in your mouth, and that sort of thing. That would
That is, and
put you at a higher risk of actually acquiring.
I don't want to go too deep in that, but that is why, if you check the statistics, there are more men with HIV than women. That is because of, men with men, sexual activities.
No,
so
it's
because
not
of the,
necessarily men with men.
Because of the cuts.
It's because of the type of sexual activity.
Well, yes,
we can go into it. It's because of the type of sexual activity. Because both men and women engage in anal sex. Now, the reason why anal sex is so high risk is because the skin in that area is very thin. So there is a high likelihood of tearing and therefore the exchange, the entrance of infected fluids.
So that is where we get the cuts, and then it's
that's why you need to use your condoms every time.
Okay. Yes, condoms, lubrication for both men and women.
Yeah.
And the bottomers, as they are called, the people who are on the receiving end, are at a higher risk than those who are the toppers. Okay. So all of those things you need to bear in mind as it relates to your level of risky behavior, high risk sexual behaviors. Okay.
Oh, somebody is asking, is there a cure for this virus? I don't know if they're talking about, because HIV is the virus, and then we have AIDS. So
as Louisa mentioned earlier, there is no cure for HIV. There is treatment. So the treatment can help you to manage the condition and to lower your risk of transmission.
Because if you're taking the medication, there's you're more likely to live like close to normal life, because there's a lower chance of you transmitting.
There's a lower chance of transmission. If you're taking
that medication properly, then.
If you're taking it properly and it's working well for you.
Your body is responding well to the medication.
Yeah, so you can have your partner, that one partner, you can be engaging in sex and not transmit. Your partner will not get it. If you're taking that medication.
Yes, and if you're planning to have a family with your partner, you need to discuss it with your health provider so that they can take the necessary steps to reduce the risk of transmission, number one, to your partner, and then from your partner to the unborn child.
Yeah, so it is possible to have a child even when you have HIV.
Yes, it is.
And if you're pregnant, you need to seek medical attention right away.
Yes. So one of the other ways that HIV is transmitted very easily is in utero. So while a lady is pregnant, if she is infected, it is very easy, because remember, the child is using your blood supply. So if that lady is tested, that's why they always send pregnant women to do all their labs, and included in the labs is the HIV test, so that they can start treatment early, and also as soon as the child is born, to provide some treatment to the child to further reduce the risk to a minimal level of risk if you are infected with HIV, so that there would be a minimal level of risk to the child getting that infection.
And some guidance too, don't forget the education about the breastfeeding and all of these things, especially as a pregnant mother who is positive for HIV and so on. So these are the things that they really do. That is why if you know you're HIV positive and you're pregnant, you need to seek medical attention right away. Don't stay home and keep on thinking, getting depressed at home. Just go out there and seek medical attention so you know where you stand at least. And again, don't forget you have your baby, and like Fawn said, to cut down the risk of infection, and you want to protect your child. So that is very, very important, and so on. I was reading something, and Fawn said about the lubricant, and we spoke about anal sex, and one of the things a lot of women don't use is the female condoms. It is not out there. I think last time we spoke about it.
Yeah, we spoke about it.
And I mean, these are one of the things we can easily try, the female condoms. And another thing I was reading is the oil-based lubricants weaken the condoms and can cause them to break. So that is why they're asking it's better to use the water-based.
And when you say oil-based,
I didn't even
c'est
know
mon
that.
pas pon Vaseline servi. I don't. Do not use Vaseline. Do not use baby oil. That is not what we mean when we say lubricant. Don't run take your local coconut oil. Nothing so.
For you too dangerous.
Go to the pharmacy. Go to the pharmacy and get a proper water-based lubricant so that you can use and use it safely, so you know that the integrity of everything is maintained. So, ou pa pon chance pa servi Vaseline ti mama e la.
Lord have mercy. I never expected that from Fawn. That was an element of surprise. So, I mean, and in reading last night, I actually saw them saying, my God, all the time you're using one thing, you don't really know, what can really happen. And in educating yourself, you really get to know so many things. And another thing is, if you engage in oral sex and so on, it's wise to use your dental dam. It's a piece of medical grade latex. I don't see it on the shelves in our pharmacy. The last time I saw it was in my drawer. But, these are things you can use. You can find out where it is available. Especially you can buy these things online.
I've never heard of that one.
The dental dam?
Yeah, I've never heard of that one.
There are different flavored ones for persons engaging in oral sex, just to protect yourself. And so, it's
used on the female. So it's
female,
on the female. Yeah. So
Fun, explain to him.
Yes, I've never heard of
yes,
that one.
so it, as she said, it's a piece of latex. So you cover the female genital area with it if you're going to be engaging in oral sex.
Oh, okay.
With a female.
I thought it was
So for the
male,
male you'd use a condom. So in that case, people may prefer to use a flavored
The
condom
condom.
because you don't you know.
I didn't know that.
Yes.
You didn't know that one? Oh my God. First time you don't know something. First time you don't know something.
I learned something new today.
Where you do more research.
Yes, I learned.
And dental dams are quite good, I must admit. It's not a very commonly used thing, but I mean, when you start using it, you really get to the groove of it. And it's always nice to try something new. A lot of us are afraid to try new things. Again, at the end of the day, you want to continue protecting yourself, protecting your partner, especially if you know you have multiple partners also, and you want to protect the person that is the real partner in there. So all of these things you can do, and with the advent of the internet and ordering online, I mean, everything can be, you can get anything
I
online.
will just put a caution on that because there are certain items that are not allowed to come in. I'm not sure whether
Dental dam?
I'm not sure which are prohibited. Maybe we can.
We need to research that one.
Maybe
for
we
true.
can have one of our police officers to join us
I'm saying a dental
and
dam,
help us
plastic.
because there are other sexual toys and so on that are not.
I don't know why those things are prohibited. I don't see the risk.
Yeah.
But
We can have that conversation at a later date.
All right.
Is there a risk involved?
We can have that conversation at a later date as to the rationale behind it.
That topic is too hot for me today.
For a Monday morning.
A Monday morning. But whereas we we speak about it, and these are the things that society really needs to hear. Because a lot of people think, that's not for them. And a lot of people think, oh, I'm a married person. That's not for me. And people fail to realize society has evolved. And we need to keep our minds very open when it comes to these things. I mean, you can be that stay-home person, and lo and behold, your partner, end up bringing whatever that they're bringing home to you, and and how do you cope with it? And again, sometimes it's always wise to go for a little counseling, especially if you have been involved in risky behaviors, or you have put somebody's lives in that kind of category. Go for a little counseling and let them guide you, because a lot of people keep it and they go through depression and all kinds of stuff. Counseling is very important, especially when it comes to, not only AIDS, HIV, but other STIs. Some people really do need the counseling for them to get through it. And we're asking persons, our wellness centers, our mental health nurses are available. You can always make an appointment if you want a little counseling. It's all well and good educating you, but how do you cope when you find out? Or how do you cope when you feel that you're at risk? Before you can actually take corrective measures. So counseling is very, very important, and so on. It's true that we say confining somebody, but if there is nobody you could trust, the medical professionals are there. And, some people might not be comfortable with one person, but they might decide to go to their private doctor and so on. It doesn't have to be the wellness center. You can go to your private physician and so on and get the necessary guidance that you really, really need. Okay? Yeah. Once you live in our communities are small, everybody know each other. So sometimes you really need a level of privacy. And we're saying, yes, you can come to the wellness center, but if you really need a level of privacy, and not that going to the wellness center, you don't get privacy, but it's just that everybody knows each other in the community. You can seek medical attention in other communities or privately if you so desire. But at the end of the day, the best thing is that you took action and you got medical help. Right, Fawn?
Yes, indeed.
Okay, so having said that, before we go, Fawn, you want to add anything? It's almost 11.
I just want to remind everybody that at the beginning of the program, we said there's an urgent need for blood donations. So please consider it. If you have never donated blood, maybe now is the time to take that step. If you were a regular donor and you have not donated for a little while, maybe because of COVID or for whatever reason things happen in life, give the gift of blood. If you have nothing else to give to anybody, give the gift of blood this season. It may be a family member or a friend who may be in need in a few weeks, in a few days. You just never know. And the wonderful thing about donating blood too, which relates to our topic, is that the blood is tested. So after you have donated, if you don't know what your blood type is, you receive a letter stating what your blood type is, and they tell you that you may be free of HIV and whatever else. If you have a condition that requires attention, you may receive a call. Okay? So there are benefits. You not get money, as Romana said. They give you a malt, but if the malt is not incentive enough, remember that you're doing something for yourself, but you're also doing something to help your community. Many people need blood for different reasons. People go in for a routine surgery, something goes a little awry, you need extra blood. Somebody goes to deliver a baby and something goes wrong, they need some blood. You're driving down the road, you get into an accident, you may need some blood. You just never know what situation will lead you to need blood or lead somebody close to you. And we don't always have to think about family and friends only. Just do it for your community. Just because that person's life is also important. The person has family, the person may have children, they may have other dependents, elderly parents, all of those things. So just consider it and take the steps to do it.
Wonderful fun. I just have a few announcements. On Sunday, December 11th, the Magouge and Delse Wellness Center is having a walk. And that walk is from the Wellness Center at Magouge, and those persons from the Delse community starts from the Delse Wellness Center down to Sabusha Beach. This initiative is for diabetics and hypertensive individuals, but they're welcoming all the members of the public. They wanted to make a community activity. So persons in the Magouge, you don't have to be from Magouge or Delse, but Choiseul area, you can join in. It's going to be fun. It's going to be exciting. It gives you a chance to, spend some time with community members, loved ones, and so on.
I'm just going to assume that there's no cost, there's no registration fee.
No
right?
cost, no registration fee.
So all you need to do is dress up, put on your shoes,
bring your water,
yes,
and so on.
So what time does it start?
Bell question. I forgot to ask nurse, but you can call the Delse and the Magouge Wellness Center and they'll tell you the starting time. Sorry about that. That's one of the things I forgot to ask. So feel free. I'm sure they have been advertising it in the various communities. So feel free to come out on that date, Sunday, 11th December. All right. Also, the flu vaccine is available. We welcome persons to come in to get their flu vaccine. And feel free to stop at our wellness center and ask about the flu vaccine.
Particularly those people with chronic conditions, those of you with diabetes, hypertension, and those chronic conditions that flu okay? So the flu vaccine is meant to reduce the effects of the flu on you. This around this time of the year, a lot of people get the flu.
That is true. And don't say it's around the Christmas season where they shot on my influence. So always remember that. At our clinics, we have the flu vaccine available. And last week, I did mention the mental health team is asking persons to donate items of clothing, especially large sizes for men. Good clothing, please. And you can always drop it at the Soufre Hospital. The mental health team will readily accept it. So take some time, look at your closet. Some persons have lost weight. They don't need these items of clothing anymore. Clear out the house and so on.
Be careful when you say clear out the house. They let the moun ka just le yo ka nettoyer, yo just ka amasse tout bagay ki yo ka vin laje la. C'est pas ça nous vle.
Nous bon bagay.
Nous vle bon bagay. Nous pas dou acheter un magasin. But if you are going to donate, think of whether you would wear the clothes that you're donating. Because one of the things I've noticed on clothing drives, at the end of the selection process, you have so much to discard. The things are stained. They're white from having been washed so many times. Some of them are torn. Some of them have no zip where there should be a zip. The zip is broken. So examine the clothes before you donate them. Remember, if you would not wear them to walk down the street, you'll not wear them in town, you'll not want anybody to see you in those clothes, don't give it to another person. In as much as we are asking you to donate, we would appreciate it even more if you would take the time to carefully select what you are going to donate. Ek mwen sab mwen comparison, but yes, that is it.
I couldn't say better.
I saw Louisa give me a look. I think that had me fun hard dear comparison. But no, honestly.
I couldn't have
put yourself in the people's position. If you lost everything today and somebody came to dump a garbage bag full of clothes that are just worthless at your doorstep, how would you feel? You would not want. You'd feel even worse. Ou min pou di men se sa moun na kapote ban même si mwen pani. Ou kwen se sa moun na kapote. So, all right. Thank you very much. And I'm saying it with a pleasant smile. Back when we had the comparison, we just play the best for others.
Let me just say this. Before we came here, Fonte, Louisa, all what you say, I'll be shaking my head. So, and I've been observing her throughout the program. You know, she's speaking more than me, so I'm glad. So I'm saying to myself, it's always a pleasure. Let me just say, that is what teamwork is all about between Fawn and I, and as well as Romanus. I am so happy that, this program was a breeze. And the discussion, although it's about AIDS and HIV, it was a general discussion of what we actually see in our own community and a lot of the perceptions that people have about the topic. And again, let me just say thank you to all our listeners, especially those at M&C Drugstore, our people from Connery's. I am so very grateful that a lot of you take time to listen, our Chazelians, Sufrerians. We have listeners that are constantly taking time off their schedule to listen to us. Persons online, again, we can say thank you so very much. And we also would like feedback, although we didn't say anybody can call in and whatever. But it would really be nice for us to get feedback, good constructive criticism about the program and what persons would really like to hear about, and so on. So again, thank you to all our listeners and Fonny and as well as Romanus.
Thank you.
Thank you.
It was a pleasure. Have a good day.
Thank you.
10 a.m. to 11 a.m. with the consultant. Health is not merely the absence of diseases.